Are you in every way, woman?
Welcome back to Every Way Woman. We're talking breast cancer and the team you're going to need along the way. Welcome a few doctors from Breastlink to the show. And I want to start with you, Dr. Paris, because you are the first in this process.
Most of the time I am, essentially, because the patient would come in for her imaging once she has identified a lump in her breast, or her doctor has felt the lump, or she's coming in with pain or some type of skin change. Or she could be coming in because I called her back because I see something on her screen and mammogram.
It's interesting you say pain or skin change. Is there often pain associated with a symptom of breast cancer?
Most breast lumps are painless when it comes to cancer, but sometimes there is pain associated with it, and a patient might come in and she might say, I'm having focal pain here. We may not see a mass, but we might see distortion of the tissue, and that leads to further workup and a possible biopsy, and it usually is positive.
So what is your official title or role with Breastlink?
So I'm a radiologist, and I subspecialized in breast imaging, which means I did a fellowship in that, so I'm fellowship trained for breast imaging, and that is my focus. I'm the medical director of the Temecula Valley Breast Imaging, one of their centers that they have in Temecula.
So one of a patient's first stops then would be with a
radiologist.
Radiologist,
correct.
Okay.
And so after she has her imaging, if the biopsy shows that she has positive disease, she's then referred to
the rest
of the team, which involves the surgeon, the oncologist, the radiation oncologist, the plastic surgeon.
So then the next step would essentially be you, Dr. Kapoor?
Yeah, us as surgeons, we will see the patient and try to guide them through the process and the steps that are going to be required to get them through their treatment. There can be sometimes very limited steps with just surgery and radiation. Sometimes you need a lot more. Sometimes you need, plastic surgery and reconstruction. Sometimes in more severe cases,
Why did you choose this role in the breast cancer spectrum in this?
We started as surgeons, all of us. So we started as general surgeons because we love to work with our hands and do something and actually create and affect a treatment. Breast surgery was fascinating because we can actually get rid of the cancer, potentially affect a cure for a patient, and then we work with patients throughout their whole process. It's a really meaningful way of practicing medicine and surgery.
And what's the next step?
So after surgery, depends on the kind of cancer they have. Oftentimes, if we are hopefully saving the breast, then we refer them to a radiation specialist, a radiation oncologist for their radiation treatment. In some cases, they need chemotherapy. So chemotherapy may happen before surgery or after surgery. And it is our role as surgeons to really help them figure out what the next step is.
And navigate that process.
Absolutely.
Is there any particular types of cancers where one would necessitate chemo as opposed to another requiring radiation? Like, what differentiates between them?
Yeah, all of us are readily dealing with this on a regular basis, actually. Some cancers can be very small, but very aggressive, and they actually need chemotherapy, whereas a large cancer might be very slow growing and doesn't need chemotherapy. So we really have to make sure we look at the biology, understand the tumor itself, and figure out, is this something that we need chemotherapy for? And sometimes even before surgery.
And what is the difference between the two types of treatment?
Yeah, between the two types of
chemo and radiation.
So they're very different. It's a good question. Patients don't understand the difference that, if I have this cancer, can I just have surgery? Do I really need radiation? There's a big difference. I mean, I'm sure you guys have that question regularly, too.
And what I like to explain to patients is radiation is a local treatment. It's like surgery. It just sterilizes the breast if we do a lumpectomy to make sure we're not leaving any cancer cells behind. But chemotherapy is addressing if we're concerned that there might be cancer cells in the bloodstream. So that could potentially go someplace else and lead to metastatic disease.
Dr. Curacao, what is your role in this team?
Well, our role, a lot of times the surgeon is the director initially, because we're really kind of saying, okay, now you need to go to the medical oncologist, now you need to see the plastic surgeon, we need to think about chemotherapy first, or maybe we need additional biopsies, maybe something on the MRI is suggestive that there might be another process going on or it's bigger. Another thing that we do early on in the patient's course, and I think it's very important for patients to have this with their care team, is we present the patient at a multidisciplinary conference. So we sit down with our radiologist, our pathologists, the surgeons, the medical oncologists. We talk about the patients and we decide, is it right to do surgery first, or should we be thinking about chemotherapy, or do we have research protocols that this patient might be eligible for?
Yeah, our team is key on that, having the research involved, making sure that early on we have all those available resources available, genetic testing, clinical trials, surgical trials.
Dr. West, you've also mentioned that there are other players on the team beyond the doctors. There's the social workers, there's the therapists. Tell me about those players.
I think there's no two women that are exactly alike and no two cancers that are exactly alike. We can kind of characterize the cancers with the various studies. So we have a pretty good idea. Are we dealing with an aggressive cancer that needs to go to chemo first, or a cancer where we can likely save the breast with a good result, or somebody that would really benefit from a plastic surgeon? So we have to kind of think about all that. But you also really have to look at the patients and see where they're coming from. Sometimes the first visit, it's just a matter of trying to get them to settle down and hold hands with, their partner or with me or somebody on our group to find some resources, and then let this sink in and kind of go slowly. Other people, Dr. Kapoor and I, Dr. Curcio, we'll call Dr. Link in and say, look, this isn't a surgical problem. You've got a cancer that's aggressive and we need to shrink it down first. If we shrink it down and make it go away, you won't need, much lesser surgery, and we know you're going to have a great prognosis.
And that would be great news. I want to talk more about treatment with the doctors when we come back right after this. Stay tuned.
Are you in every way woman?